Hollywood is a place where beauty is currency, and for some female actors, the pursuit of perfection comes with lasting consequences. Cosmetic procedures can enhance confidence, but when taken too far, they can permanently alter the features that made stars iconic. From subtle adjustments gone wrong to dramatic transformations, these celebrities reveal the fine line between enhancement and excess. Courtney Cox gained fame with Friends, 1994 to 2004, admired for her expressive blue eyes and natural charm. Known for her elegance and relatable persona, she successfully transitioned between television and film. In recent years, however, Cox experimented with Botox, fillers, and possibly a mini facelift. These procedures altered her natural expressions, giving her a taut, more socialite-like appearance. She admitted pursuing youthfulness through cosmetic work, but later had her fillers dissolved to return to a more natural look. Despite this, traces of past surgeries remain, showing how even small interventions can permanently affect the face. Cox's experience highlights the subtle but lasting impact of repeated procedures. Next is an actress whose Hollywood grace changed dramatically over time. Laura Flynn Boyle rose to prominence with The Practice, 1997 to 2004, and became known for her classical Hollywood features. Her porcelain skin, sharp jawline, and refined expressions made her a fan favorite. Over the years, however, Boyle's face underwent significant changes due to multiple cosmetic procedures, including rhinoplasty, lip augmentation, brow lifts, and dermal fillers. Her cheeks and lips appear overfilled, altering the balance of her original features. While some photos may exaggerate the effects, repeated interventions have noticeably changed her appearance, leaving fans struggling to recognize her. Boyle's case illustrates how even incremental surgeries, when accumulated, can overshadow natural beauty and elegance. Next on the list is a Hollywood icon whose face became a subject of headlines after cosmetic work. Farrah Fawcett, forever iconic from Charlie's Angels, reportedly underwent multiple procedures later in her life, including a facelift, a neck lift, and eyelid surgery, blepharoplasty. Some sources also claim she had a rhinoplasty. While these interventions were likely intended to tighten her skin and preserve her signature beauty, the results sparked debate. Some fans argued she lost some of her natural softness, while others defended her right to age on her terms. Critics pointed out that the rejuvenation came with a cost, subtle expression changes, and a look that was less familiar than her younger self. Fawcett's story illustrates how even carefully chosen surgical work can provoke strong reactions, especially when someone is beloved for their original, timeless image. The next star's facelift, however, went badly wrong. Jennifer Grey became a household name with Dirty Dancing in 1987, earning admiration for her sweet charm and expressive features. Her portrayal of Baby made her a teen icon, but it also cast a long shadow over her career, making it challenging to secure diverse roles afterward. Complicating matters, Grey underwent rhinoplasty, removing a dorsal hump from her nose. Unfortunately, the surgery dramatically altered her appearance, leaving her barely recognizable and further hindering her career opportunities. Despite the setback, Grey persevered, appearing on television and winning Dancing with the Stars in 2010, proving her resilience. Her experience highlights the risks of even seemingly minor cosmetic procedures, especially when facial identity plays a crucial role in an actor's career. While the surgery was intended to enhance her look, the result illustrates how alterations can unexpectedly overshadow natural charm and public perception. Next, we examine a Hollywood legend whose facelift stirred considerable debate. Goldie Hawn, celebrated for her effervescent charm and timeless beauty, underwent a facelift in an effort to maintain her youthful appearance. Known for roles in Private Benjamin in 1980 and Overboard in 1987, Hawn's radiant personality often outshone her looks. Her facelift, however, drew immediate public attention, with fans and critics noting changes that seemed inconsistent with her natural features. Surgical complications, unrealistic expectations, or aggressive techniques may have contributed to the outcome, leaving some disappointed. The experience sparked discussions about the pressures celebrities face to uphold an idealized image, and how even minor adjustments can become magnified under public scrutiny. Hawn's case serves as a cautionary tale for those considering cosmetic interventions. it is crucial to balance personal goals with realistic outcomes. Despite mixed reviews, Han continued her career, reminding audiences that talent and charisma often transcend appearance. Next on the list is another actress whose facial procedures became a hot topic. Melanie Griffith, known for Working Girl in 1988 and other iconic films, faced intense public scrutiny after undergoing a facelift. In pursuit of a youthful appearance, Griffith's procedures reportedly included skin tightening and facial enhancements. While her goal was to refresh her look, the results were controversial, drawing mixed reactions from fans and media. Possible factors behind the outcome include surgical complications, the techniques used, or an overly aggressive approach to change. The public criticism emphasized the harsh standards female actors often face regarding aging and appearance. Griffith's transformation serves as a vivid example of the delicate balance between cosmetic improvement and overcorrection, as even minor changes can dramatically affect public perception. Her journey reflects the pressures of Hollywood, where maintaining youth can feel like a professional requirement. Yet, the results may overshadow inherent talent. The next actor's transformation shocked audiences and redefined her public image entirely. Megyn Kelly, well-known journalist and TV host, has publicly shared that she uses Botox regularly to smooth forehead lines and frown wrinkles. She is, however, vocal about rejecting dermal fillers, calling herself very anti-filler because she believes they go wrong too often. Kelly prefers a more conservative approach to aging, combining injectables with gentle lasers in her skincare routine. While she doesn't admit to dramatic surgical interventions, her commitment to reshaping and maintaining her face reflects the tension many public figures face, wanting to age gracefully without looking overdone. Her transparency about what she's willing to do and what she avoids shows that even small cosmetic choices can shape how celebrities present themselves over time. Next is a Hollywood legend whose surgical journey became very public and controversial. If you're enjoying this journey through Hollywood transformations, make sure to hit the like button and subscribe to the channel. Comment below which celebrity's transformation surprised you the most so far, and turn on notifications so you don't miss the rest of our shocking reveals about plastic surgery in Hollywood. Anjelica Huston, daughter of director John Huston and model Enrica Soma, is celebrated for her commanding presence and timeless sophistication. Roles in Prizzi's Honor in 1985 and The Addams Family in 1991 established her as a Hollywood legend. In later years, Huston underwent cosmetic procedures, reportedly including facelifts, fillers, and skin tightening treatments. These interventions sharpened her features but reduced the natural expressiveness that once defined her face. While intended to preserve youth, the results received mixed reactions, with fans noting a more rigid appearance at public events. Huston's experience reflects the pressures on aging actresses to maintain a youthful look, and how cosmetic interventions can sometimes overshadow innate elegance. The next actress's transformation would shock audiences and redefine public perception of her beauty. Sharon Osbourne has been candid about her long history with cosmetic surgery, including at least 4 facelifts. Her most recent procedure, a full facelift in 2021, was a turning point. She described waking up in bandages, comparing herself to a mummy, and later saying she looked like a cyclops due to uneven eyes. The surgery left her with scarring and a numb mouth, which she said lingered for weeks. Following this painful experience, she declared she's done with major cosmetic surgery. Osbourne's journey underscores the risks of repeated procedures and how even experienced patients can regret pushing the aesthetic limits. Coming up next, a musician turned celebrity whose surgical choices sparked strong reactions. Meg Matthews, former music manager and ex-wife of famous British musician, has been less publicly forthcoming about extreme plastic surgery compared to others on this list. However, in celebrity circles and tabloid discussions, she has been linked to face enhancements and minor cosmetic interventions. While definitive, well-sourced claims about surgeries like facelifts or major structural work are sparse, speculation centers on her use of fillers and Botox to maintain a youthful look as she aged in the public eye. Critics argue that some of her photos over time reflect unnatural smoothing and volume changes typical of repeated injectables. Her experience represents a more common cosmetic path, not radical transformation, but persistent aesthetic upkeep. A reminder that surgery doesn't always mean drastic change, but even small enhancements can alter one's look significantly. Next, we'll explore someone whose transformation became a viral spectacle. Courtney Stodden first gained fame as a reality star and model, making headlines for marrying much older actor Doug Hutchison at just 16. Her youthful fame quickly led her down the path of cosmetic enhancements. By her late teens, Stodden had openly experimented with Botox, lip fillers, and breast augmentations, sparking media scrutiny over her extreme transformations at such a young age. Over time, she revealed additional work, including dermal fillers and teeth whitening, aiming to craft a glamorous, Instagram-ready image. Stodden's frequent public appearances showed increasingly dramatic changes, with critics noting a loss of natural facial expression. In interviews, she emphasized her autonomy, stating her procedures reflected personal choices and self-confidence rather than societal pressure. However, her early start serves as a cautionary tale about the psychological and social implications of cosmetic surgery at a young age. Next, we examine a celebrity who turned lip fillers into a cultural phenomenon. Kylie Jenner, a member of the Kardashian-Jenner family, became one of the most influential figures in modern celebrity culture. She is famously associated with lip fillers, which she openly admitted to using around 2015, sparking massive public and media attention. Beyond her lips, Jenner reportedly underwent dermal fillers, jawline contouring, and non-invasive facial enhancements, all contributing to a highly polished and sculpted look. Her cosmetic choices coincided with the rise of her makeup brand, reinforcing her carefully curated public image. While she initially denied lip injections, Jenner later admitted the procedures, claiming they boosted her confidence. Critics and fans alike debate the impact of her transformations, with some arguing she set unrealistic beauty standards, particularly for teenagers. Despite controversies, Jenner's approach to cosmetic procedures reflects the modern blend of social media influence, personal branding, and aesthetic experimentation. Coming up next, a reality TV star whose treatments have become a signature talking point. Lisa Rinna, actress and reality TV personality, has long been recognized for her bold and noticeable approach to cosmetic enhancements. Best known for roles on Days of Our Lives and The Real Housewives of Beverly Hills, Rinna has undergone facial fillers, Botox, lip injections, and possibly cheek and jawline augmentation, all contributing to a visibly youthful yet highly sculpted appearance. Her transformations have sparked both admiration and criticism, with tabloids frequently comparing her looks over the decades. Rinna herself is candid about her procedures, often defending them as part of her career and personal confidence. Experts note that while her enhancements are prominent, they are carefully maintained, reflecting a strategic approach to aging in the public eye. Her willingness to openly discuss her cosmetic journey has made her a reference point in conversations about celebrity treatments and the balance between self-expression and public scrutiny. Next, we look at a UK celebrity whose body and face surgeries are extensive. Jodie Marsh, a British media personality and model, is widely known for her extensive body and facial cosmetic procedures. Over the years, she has undergone multiple breast augmentations, liposuction, Botox, dermal fillers, and facial sculpting, transforming from her natural appearance into a highly polished public image. Marsh has been open about her surgeries, describing them as empowering and enhancing her confidence, though critics often accuse her of overdoing treatments. Her facial enhancements, including prominent cheek and lip fillers, have drawn significant media commentary, and she has openly faced the consequences of public scrutiny. Despite this, Marsh continues to embrace cosmetic interventions as a lifestyle choice, exemplifying the modern celebrity pursuit of beauty perfection. Her story highlights the pressures of public life in the UK entertainment industry and the extremes to which some individuals go to maintain a carefully curated, youthful, and glamorous look. Next, we examine a Hollywood actress with subtler yet debated enhancements. Vanessa Hudgens rose to fame through Disney's High School Musical series, admired for her natural beauty and girl next door image. Over the years, fans and media have speculated about subtle cosmetic procedures, including rhinoplasty, lip fillers, and minor dermal enhancements, though Hudgens has never publicly confirmed extensive surgery. Comparing her early career photos with recent appearances, some observers note refined facial contours and slightly fuller lips, which could be attributed to non-invasive treatments or professional makeup techniques. Hudgens' approach, whether surgical or not, reflects a restrained and cautious take on cosmetic enhancement, maintaining her natural charm while adapting to aging in the public eye. Her transformations, if any, are subtle enough to preserve recognizability and personal brand consistency. Hudgens' case illustrates that cosmetic procedures do not always have to be extreme to generate discussion, and that even small enhancements can impact how celebrities are perceived by audiences and the media. Thank you for watching. Don't forget to like, share, and subscribe to the channel so you don't miss any new videos. See you in the next one.